Hello, and welcome to the patient education series about diabetes medications. My name is Tamara Shrianat, and I'm a physician assistant working on behalf of Dr. Wasim Huck with North Texas Diabetes and Endocrinology in Flower Mound, Texas, and Close Care. Today, we will be covering a group of medications known as SGLT2 inhibitors, which includes Jardiance, Farxiga, Invokana, and Stiglatro. If you've been prescribed one of these agents, we hope this video helps you better understand how the medications work, any potential side effects, and what their role is in managing your diabetes. What are SGLT2 inhibitors? SGLT2 inhibitors are tablets that help prevent glucose from being reabsorbed in the kidneys. Through this mechanism, these agents eliminate extra glucose in the urine. The blood glucose levels are thereby reduced. These medications can reduce the A1C by 0.5 to 1% over 6 months of treatment. They also help promote weight loss. SGLT2 medications are available in the following doses: Jardiance, 10 milligrams and 25 milligrams. And Invokana, 100 milligrams and 300 milligrams. Other available doses include Farxiga 5 milligrams and 10 milligrams, and Stiglatro 5 milligrams and 15 milligrams. SGLT2 medications are also available in combination with other medications, such as Invokamet, Glixambi, and Steglujan. Other combinations are listed below. When should I take my medication? In general, SGLT2 inhibitors are taken once daily with or without food in the morning. The healthcare providers will generally determine when the dose needs to be increased after 6 weeks with review of the patient's home blood glucose monitoring log. They may also review the 3-month average based on your hemoglobin A1C. If you are on a combination pill, you may need to take the medications twice daily as directed by your healthcare provider. These agents are generally well tolerated. However, sometimes side effects may occur. These side effects may include an increase in urination, bladder or kidney infections, or yeast infections in both males and females. There is also a potential for lower blood pressure, so close monitoring of blood pressure and possible adjustments of some of these medications, such as diuretics, is encouraged. Kidney function should be checked prior to initiation and during subsequent follow-ups. In combination with some medications, such as sulfonylureas or insulin, there is also a slightly increased risk of hypoglycemia. These agents by themselves do not cause hypoglycemia. Rare but more serious side effects include lower limb amputations, bladder cancer, increased fracture risks, acute kidney injury, or Fournier's gangrene. Remember that these last potentially severe side effects are extremely rare. One rare but serious side effect that any patient on SGLT2 inhibitors should be aware of is diabetic ketoacidosis, or DKA. DKA occurs when the body doesn't have enough insulin and acid levels are elevated in the blood. This is a rare condition that warrants urgent medical evaluation. The most common occurrence for this is during the time of surgery, severe infections, or any illnesses. To prevent DKA, please hold the SGLT2 inhibitor medications prior to a major procedure, before surgery, or any time you are ill, not eating consistently, or vomiting. Always consult with your medical provider. Common symptoms of DKA include nausea, vomiting, abdominal pain, rapid breathing, dehydration, dizziness, and thirst. Remember, the glucose is generally normal during these bouts of DKA that's induced from SGLT2 inhibitor use. How to prevent DKA? Here are some suggestions. Be sure to hold your SGLT2 inhibitor medications at least 1 to 2 days before fasting for surgery or a major procedure. If you are unable to eat or drink, such as due to nausea or vomiting, or feeling unwell with an infection or illness, it is also advised to not take your SGLT2 medication. Please avoid ketogenic diets as it can precipitate DKA. And remember, always check with your healthcare provider if starting or stopping your medication. The patients who should not take SGLT2 medications include those with recurrent bladder or yeast infections, or those with severe or end-stage kidney disease. Anyone who is on a very restrictive carbohydrate diet, such as ketogenic, is also not a good candidate for this class of medications. And finally, patients with type 1 diabetes are also not advised to take SGLT2 medications. Be sure to avoid drinking alcohol with these medications as it can lead to ketoacidosis. In conclusion, SGLT2 inhibitors are a special class of diabetes medications with multiple benefits. They can generally lower the blood glucose without inducing hypoglycemia. They are also associated with weight loss, cardiovascular or heart benefits, and they can be associated with prevention of progression of diabetic kidney disease. Please remember that this video is to be used for informational purposes only and not to be used in substitution with consultation with your unique healthcare provider. Please reach out to your healthcare provider with any questions you may have regarding your medical management. Thank you again for joining us, and good luck.